उसका ट्रांसलेशन करना भी तो उतना ही मुश्किल है कि अगर हम इंग्लिश से हिंदी में भी ट्रांसलेट करना चाहेंगे तो बहुत मुश्किल है। तो उसे समझना तो उससे भी बहुत ज्यादा मुश्किल है कि स्पिरिचुअलिटी और माइंडफुलनेस में डिफरेंस क्या है और उसका ब्रिज कैसे हो सकता है। um, आप कुछ दो शब्द कहिए तो शायद कॉन्वर्सेशन शुरू हो सकता है। वी हैव
right. So let me start this thing because we have only 2 minutes. So first of thing, let's take away this thing. It's very difficult. When we first of all say that's difficult, that makes it difficult. So our conversation should start with that thing that it's not difficult. First of all thing, because many persons made the things very difficult and complicated. Because mindfulness, spirituality, these are very simple things. Anyone, anywhere, anytime can practice. So first of all, let's ponder upon and accept this thing. This is very easy. So when we start the easy things, life becomes very simple and we can think about it and we can answer in simple words. Einstein says, and one more scientist has said, बोले आपको मैच्योरिटी कब लगती है, मैच्योर हो गए हो, आप बहुत नॉलेजेबल हो गए हो, आप कैसे जानते हो? तो बोले जो आदमी बहुत कंसेप्ट को सिंपल वर्ड में समझा देना, इसका मतलब वो मैच्योर हो गया है. So think about the life where the things are very simple. They're not complicated, not difficult. I think spirituality and mindfulness are very connected with each other because spirituality is being with the spirit. Very simple. Spirituality means being with your spirit, and mindfulness is experience this spirit in every moment. I think this will be enough. So let's ponder upon, not going deep into this. So this is the bridge. You can ponder upon, meditate on this, and you can write few words about this. Also, the time is 10:10, and I will love Dr. Ranjan to introduce our today's speaker, Dr. Bhavani.
Dr. Bhavani is a MBBS doctor and family medicine physician. She is also board certified lifestyle medicine physician. And she is mindfulness facilitator, trained with one UK body, one university. And that doesn't matter for the practicing mindfulness, that certification or that the state of the one who is speaking. So Dr. Bhavani is going to lead us in the mindfulness. And mindfulness traditionally it is more associated with the spiritual practices, but it's also related with the health. So since we are doctors, so our role is to connect to wide domain of spirituality today, mindfulness, how to associate it with health. So now I request Dr. Bhavani, kindly do start. We welcome on
Dr. Bhavani, welcome to a platform, Spiritual Doctor for Holistic Health. This is your first session, so we call R, but when you come on a second time, it's become yours. So I was just discussing before you were introduced about the mindfulness, spirituality and connection, and hope this will put our session in forward direction. And I will love to guide my every participant today who is listening right now or will listen on the YouTube also, that listen this session mindfully. So this is the practice of mindful listening. Over to you, Dr. Bhavani.
Thank you, Dr. Ranjan, and thank you, Dr. Sandeep. Thank you for having me here today, and thank you so much for the brief introduction. So you've already started the discussion with a brief, intro into what is mindfulness and what does it stand for you. So as we started the discussion already, I'm just going to show a small picture and then take it into discussion further. So allow me to share my screen.
It's visible.
Just a moment. So when you hear the term mindfulness, already Dr. Sandeep has given a brief intro into mindfulness. When you hear the term mindfulness, what is that? That is coming up for you. It could be a thought, it could be a word, it could be an emotion, or it could be something that you have just heard somewhere and you are very inquisitive or curious about it and you want to know more about it. So if you could just unmute yourself and say, or you can even put it in a chat, what is that word that comes to you when you heard the word mindfulness?
Awareness, Vinod is saying awareness. Very good, Vinod.
Yeah.
Being present, Maitri is saying being present. Very good.
Yeah.
Being aware of your thoughts, Manish is telling.
Yes. And watching or listening with full awareness, concentration. Yeah. Yes. Thank you so much for that. So when you see this picture on the screen, you would all resonate with the person on the image, isn't it? Most of the times, our minds are so full with a lot of things. Some could be really important, but many could be just clutter, which is taking up the space. And when you look at the other image that is there, where there is only what the person is seeing, or where the person is actually attuned to the present moment, you can see that there is a lot of spaciousness. It's not only being present only to that moment, but there is also a lot of clarity, there is a lot of focus, there is a lot of connect with what is actually happening in the moment. So why is this important? Why shouldn't our mind be full? Why should we choose to be mindful? And if we care to answer that question, and we go 1 second, just give me a moment. Yeah. So if we have to answer that question, we have to go into the study, which says that this is by two scientists in Harvard, where they have reached out to around 2,000 participants via a app-based inquiry. They were tracking the emotions, thoughts, moods, and actions of these 2,000 participants throughout the day. And what they found out is that 47% of the waking time is spent in wandering, as in our minds are wandering 47% of the time. Even when we are engaged in activities or we are just resting, our minds are wandering almost 50% of our awake time. And what does it translate to is that when the mind is wandering, the people have also reported that they have sense of unhappiness in that period, which translate that a wandering mind is an unhappy mind. And another interesting finding that came across in this study is that when a person is engaged in an activity, okay, not with the wandering mind, but actually being present and engaged in the activity, in the positive psychology sense, it's called as the flow of the work. When the person is engaged in that activity, they experience happiness. It could be anything. It could be their work, it could be school, it could be their college, studies, exam, or anything, even the perceived activities that could provide stress. But if they're actually engaged in it, they are happy when compared to imagining a pleasant situation or being in a pleasant situation. So what is important here, what it translates to is that if we are present in the moment with awareness, it directly translates to the joy and happiness that we can experience in our day-to-day life. With this background, if we now look at what actually mindfulness is, what does the word convey? The history of mindfulness, if we look deeply into mindfulness, the practice has been taken, or its roots can be found in the contemplative traditions of Buddhism. It's not actually the religious practice, but the spiritual practice of Buddhism. So from there, it has been taken and it has been popularized in the West. mainly by John Kabat-Zinn, the founder of mindfulness-based stress reduction, and Saki Santarelli. And there are also a lot of mindfulness teachers who got trained, started practicing mindfulness for themselves, and then popularized in the West. But John Kabat-Zinn was the person who introduced mindfulness to the healthcare setting. He was so clever in doing that. He has taken the best practices of contemplative traditions and supported that with stress physiology, psychology, and the medical aspects of stress, incorporated both of those together and formed a program, which is a structured 8-week program called mindfulness-based stress reduction, based on which the mindfulness-based cognitive therapy has been developed, which Dr. Sandeep was mentioning earlier. So when we look at the definition of mindfulness as proposed by John Kabat-Zinn, it is the awareness that arises by paying attention to the present moment experiences in a particular way. So if you can see, I've highlighted 3 words in that definition, which is paying attention. Second is the present moment experience, which is the day-to-day, the moment-to-moment experience as it is happening, as it is arising. And third is a particular way. And this is very important. What is that particular way that he's talking about? Which is purposefully noticing, which is I am choosing to notice. This is a very active process wherein I'm choosing to notice what is happening to me right now, or what is happening in my body right now, what is happening in my mind right now. Yeah. And there is a certain attitudinal stance that he is bringing into the practice, which is with curiosity. When we say the word curiosity, automatically our mind correlates it with a childlike, we say that with childlike curiosity, right? So when we look at child, most of the time, children are in the present moment. They are not ruminating about the past. They are not fixating in the future, but they are in the present moment, experiencing and enjoying the joy of what it is there, joy of life. So with that beginner's mind, to pay attention to that curiosity, to notice what is happening to me at this moment right now. And the third thing, which is very important, is non-judgmentally. So this might sound a little weird also. How is that I can, non-judgmentally look at what is happening to me? Our brain, our mind are structured to have, concepts and judgments. And how am I going to look at the experience that I'm going to have without having any judgments? Yeah. And I'll be answering that question particularly in the fag end of the presentation, when we are going to discuss about how to cultivate mindfulness. But for the time being, I want you to be clear with the definition of the mindfulness. Although I say this as a definition, this is not like a hard stand definition that we find in textbooks or something like that. This is just a way of describing mindfulness so that we can get a better understanding of it. I hope it's clear till now. Yeah. So thank you. Yeah. So if we now quickly move on to the hype that is there in the popular science or in the media with regard to mindfulness. So somewhere around 1979, John Kabat-Zinn and his colleague Saki Santarelli started the mindfulness-based stress reduction program in UC Mass, mainly with patients who were suffering from chronic diseases. These were patients who were not getting any benefit out of contemporary medicines, and they were constantly stuck in a cycle of pain, stress, or stress that is arising out of their medical conditions. So when they started this 8-week program, there was not much of welcoming attitude in the scientific community. So they started this program in the basement of the UC Mass Medical Center. But now, in fast forwarding to 2023, there are around 700 medical centers in North America, which is providing mindfulness-based stress reduction program as a clinical tool for their patients to enhance their well-being, to support their health, and to promote longevity. And this is not only in North America. In England, NHS is funding mindfulness-based stress reduction program. And in their clinical guidance, mindfulness-based cognitive therapy, MBCT, has been added as one of the clinical tools to prevent relapse of depression, even recurrence of depression. So that is how far research has come in supporting mindfulness, so that now mindfulness has been incorporated as one of a therapeutic tool, a clinical tool that could effectively be used for patient care. As of this figure shows only till 2019. So when we look at this figure as of 2019, there are 1,200 indexed articles in the journal articles that are being published. And according to MRA, which is American Mindfulness Research Association, as of 2022, there are more than 2,000 articles that has been published with regard to the use, effectiveness, and side effects of mindfulness in treating various conditions of modern world, and more than 100 meta-analysis and systematic reviews that has been published. So now if we briefly look into what are the benefits of practicing mindfulness, and as clinicians, why do we have to be aware that we could prescribe mindfulness to our patients? Although there are huge benefits with regard to body, brain, and mind, I'm just going to talk about only few things here, mainly because of constraint of time. Stress is something that is universally present now, and almost 70% of the people who are visiting primary healthcare physician for their health needs have some sort of disease that is related, exacerbated, or contributed by stress. So that is how huge the problem of stress is. But are we addressing that with efficient stress management programs? It is still a question that has to be answered. Yeah. So when we move on to chronic pain, again, as I spoke, I started with this. Chronic pain is also a huge, burden on patient and also healthcare provider. As in, chronic pain reduces the quality of life, and it's also a major cause for other stresses in their life. So when the quality of life is diminished, it adds to the disability of the patient also. And mental health, again, that is one that I'm very passionate about. That is one, but the reason is a lot of times mental health issues are under-addressed in our communities. And even if it is addressed, we look into the pharmacological management of mental health issues, but we seldom look into the non-pharmacological interventions that could also help the patient. So if the patient is going to be benefited out of a non-pharmacological intervention, why not? It is it also becomes our responsibility to look into the research to find out if this is really helping the patient, and then to provide that as an alternative or as a supportive measure to the patient. And as we mentioned in previously, the quality of life that is also improving with mindfulness. How? We'll see in detail. With regard to MBSR, mindfulness-based stress reduction program, there are plenty of researches that is now in place that supports MBSR practices. And what has been shown consistently across is that there is reduction in the perceived stress levels by the patient. So why this is important is that stress, although I've said that stress is universal, It is not a situation that is only happening outside me that is causing stress. It is how I am perceiving the stress and how I am appraising that stress, and how resourceful I am in managing the stress. So all these 4 components together presents how I am perceiving the stress and what are the ill effects that I am going to experience out of stress. So when mindfulness practitioners are being followed and looked into, what they have reported is that after 8-week mindfulness program, their perceived levels of stress has come down, and they also recovered early from the stress responses, which means that if I'm perceiving a stressful situation, in my body, there are certain stress responses that are getting activated so that I handle that stress and then I get out of it. But when chronic stress, as in the person is perceiving chronic stress, what happens is that the recovery time is not sufficient enough for the person to come out of the stress. And even before they come out of that stress, there is a repeated assault that is happening. Assault as in repeated stress triggers that is happening. So this vicious cycle just goes on and on. But with mindfulness, the skills that they develop, they are experiencing reduced stress reactivity and also recover very easily from the stress responses. So this is an interesting quote which is attributed to Dr. Viktor Frankl. Between each stimulus and the response, there is a space. And in that space is our power to choose our response. And in our response lies our growth and our freedom. So the space that Dr. Viktor Frankl is talking about between the stress and the response or reaction, that is where mindfulness comes into play. Wherein, if a person is mindful, they are able to see that they have a space in between the stress and stimulus, one. Then they're also able to choose what is the appropriate reaction, or how could I react to this particular stress without being forced into reactivity, without being getting caught in the habitual reactivity patterns of life. So subjective experiences of people who have participated in mindfulness practices reinforces this, that they are able to respond better to a situation rather than react. And when they are responding, they feel that they have a better sense of control, better sense of autonomy, and this sense of control itself is increasing their life quality. And if you look at it objectively, the research supports that with persistent mindfulness practice, there is an increase in heart rate variability and there is a decrease in the resting heart rate. When we look at it, these two are predictors of resilience, and this correlates to the fact that with mindfulness, the resilience also builds up, resilience is also increasing. So with resilience, we are able to bounce back more easily when we face stressful situations. And with regard to chronic pain, what mindfulness does is, it doesn't take away the biological cause or biological reason for the pain. As if I'm suffering from arthritis of knee and I'm having pain in the knee, when I'm practicing mindfulness, still I'm having arthritis, still the pain is there. But what is happening is there, it changes the way that how I experience the pain and what is the relationship that I have with pain. So with regard to chronic pain, one is the pain itself, the sensation. But then there is another big thing that is coming into play, which is how am I relating to pain? And the most common thing that is being found is catastrophizing, which is that I'm having pain. If I have a migraine and I know that I'm going to get migraine in a particular situation, I start anticipating the attack, anticipating the pain, and this anticipation itself can increase the way that I perceive the pain. So what is my experience of pain and how am I related to this pain experience? What relationship stance I hold when I have this pain sensation? So what they have found is that with mindfulness practice, there is reduction in pain sensitivity. As in, if I can hold only up to, experience only up to 3 on a pain scale, now without much effect, I can sense the pain without much distress, even up to 5 or 6. It doesn't mean that I get tolerated to pain. It just means that I am able to hold that pain without much emotional distress associated with it. And it also increases my pain threshold. And what was also found is that the pain intensity comes down.
Dr. Bhavani, I have a question here. So you will be better to person to reply that. Is it the perceived pain which decreases and our things to resist that pain and to bear that pain increases, and because it creates less stress, or there are changes in the brain and the chemical changes in the brain and body also? So the whole thing changes.
I'm just going to come to that in the
right.
Yeah.
Right.
So answering to the question, there are multiple pathways that are there in place when we are perceiving pain, right? So to answer precisely to that question, it's the neural signature itself changes with regard to consistent mindfulness practice, with regard to persistent mindfulness practice. So there are multiple ways, multiple pathways that is happening. One is by removing the emotional distress that is associated with the pain. And the second is how this pain signal is being delivered to my brain. How the perceived pain signal is being delivered to the brain. Even that pathway has found to be different with meditation practitioners. And that is with people who are meditating for quite a long period of time. Consistent meditation practice, who have acquired more than maybe 10,000 to 12,000 hours of meditation, life meditation hours. Yeah. And
amazing.
Yeah, brain is amazing. Yes. And the other pathway that comes into play is that it also reduces the inflammation. How? The pro-inflammatory cytokines, with regard to consistent meditation practice, they found that there is decreased production of pro-inflammatory cytokines and increased production of cytokines that supports healing. So with a balance that comes in the cytokine production, they found that there is also decreased inflammation with regard to pain. So again, this translates to reduced inflammation, reduced pain. And as we spoke before, with regard to meditation practices, the patient is having a sense of control, wherein this is from a study with elderly population who have been suffering one or the other form of chronic pain, which is bringing down their perceived level of control and life quality. So when they underwent 8 weeks mindfulness program and then they have been evaluated again, what they found is that one way that they all found that it increased their quality of life is that it gives them a sense of control, which is that I have something in my hand which I can practice every day to promote my health. So just that, giving that autonomy to the patient to see this is something that you can practice every day and this is going to give you benefit. Even that small factor brings about a lot of changes with regard to perception of pain and how a patient is responding to pain. And there is also increased somatic awareness with regard to mindfulness practices. And that somatic awareness also helps patient to perceive pain in a very different way. Yeah. So moving on. So if you look at the health, mental health perspectives, there are two things that stands out. One is that the recent RCT, which has been published in 2023, states that the 8-week MBSR program is equal to escitalopram, a medication that is commonly used in anxiety disorders. MBSR is equal to the effect of medication in treating anxiety. And this is also something which is very significant in a way that I discussed before, bringing in non-pharmacological interventions as a sole or an alternative or as a supportive measure to pharmacological intervention has to be looked into. Yeah. And with regard to MBCT, which is mindfulness-based cognitive therapy, this has been developed particularly with the intention of preventing relapse and recurrence of depression. So when we see even after pandemic, the effects of pandemic and after pandemic, the incidence of depression among common population and also among healthcare workers has tremendously increased. The prevalence has increased a lot. And another significant thing that we have to keep in mind is that with one episode of major depression, there is 50% chance that a person who has experienced one episode of major depression could experience a relapse or recurrence. And if there is 2 episodes of depression that a person has experienced, then the probability that a person could experience a third relapse increase, or in this case, the second relapse increases to 90%. So depression is again like any other form of any other chronic illness, but is it gaining the needed support and care? It is not. So when there is something that could prevent such a depression, such a rate of relapse and recurrence, that has to be definitely looked into. So mindfulness-based cognitive therapy was particularly developed with regard to preventing depression and relapse and recurrence. And if you look at the overall impact of mindfulness practices on mental health, it directly promotes positive emotions. So if you look at the research by Barbara Fredrickson, who's one of the leading figure in positive psychology, she has done research with loving kindness meditation and how this translates into experience of positive emotions. And what she has found out is that with loving kindness meditation, the experience of positive emotions are increased or high, and experiencing positive emotion directly translates or links to our sense of well-being, thriving, and flourishing. So all these greatly influences our well-being and health. And with regard to mood, there is a sense of mood regulation, and also there is perception of improved mood with respect to mindfulness practice. Another important area that mindfulness helps is in emotional regulation and self-regulation. If you look at psychiatric disorders, almost 30 to 40% of the disorders are directly linked to some sort of emotional or affect dysregulation. So with regard to affect or emotional dysregulation, which is causing chronic maladaptive or maladjustment in a person, mindfulness practices provides a huge relief or huge help in that regulating their emotions and their affects. And to briefly summarize other small things that could be of interest is that there is a small but significant reduction in BP in regular mindfulness practice. It helps us to improve the sleep, not only the quantity of sleep, but also the quality of sleep is improved. It strengthens the immune functioning. With regard being a lifestyle medicine physician, I'm always interested in how it is impacting the behavior of a person and how that behavior could be translated to health. So what is found is that mindfulness practices are a great aid if we are going to look into the 5 pillars of lifestyle, which is nutrition, physical activity, sleep, de-addiction, stress management, and positive emotions, all the 6 pillars. Mindfulness plays a role. And how it promotes longevity and slows cellular aging is that with long-time mindfulness practitioners, what they have found is that mindfulness practice increases the telomerase activity. So once the telomerase activity is increased, cellular aging is brought down, cellular aging is reduced, and this translates also to longevity and as such slowing the process of aging. And to briefly talk about what is the impact of mindfulness practice on the brain. When we look back, maybe some 20 years back or 30 years back, the idea was that brain is a fixed structure, right? Once it is grown and it is there in the skull, that's all, it is there. But neuroplasticity has changed the way, the word neuroplasticity has changed the way that we look at brain now. And now what the concept or the what is significantly present there is that neurons that fire together wire together. So if you're constantly doing something, your brain develops neuronal circuits to support that activity, right? So for example, if I'm exercising regularly, the effects are not only on my muscles, on my body, but it's also on my brain. And similarly, with meditation, what has been found is that with long-term meditators, there has been structural changes in the brain. So what is happening with the structural change is that there is an increased cortical thickness in certain areas of the brain, for example, insula, prefrontal cortex, and then in the orbital cortex, wherein these are all areas of brain that are involved with awareness of what is happening inside and what is happening outside, which we can also call as self-awareness and memory, and also executive functioning and emotional regulation. So this states, or although these effects are seen in long-time meditators, we can even see this changes with regard to brain in meditators who have just been briefly meditating, right? So what they have reported is that there is, we have seen this again before, and we are seeing it again, which is increase in mood. There is better emotional regulation, better attention. So when there is better attention, it means that there is better concentration and better focus also, and the working memory has also improved. So when they looked at the fMRI of the people who have reported this and who have also been meditating briefly, they found that there were increased gyrification in the prefrontal cortex and in the hippocampus, and decreased thickness in the amygdala. So we all know that amygdala is directly related to the stress responses and to the emotional reactivity in the brain. Okay? And again, it also slows the age-related atrophy of the brain. Yeah. Now coming to the question of, we know what mindfulness is. A brief introduction has been given, and I know why I have to practice mindfulness, because it has so much of benefits. Now, how can I cultivate mindfulness? So it brings us to the question of how. So I'm going to briefly stop my sharing here and see, maybe we can discuss this, how to cultivate mindfulness. If you can unmute yourself.
So friends, the question is that how we can culminate and we can develop mindfulness in our daily life and in our work life or family life or anywhere. You can ask the question from Dr. Bhavani. It doesn't matter if you can ask the question in any language also. We'll translate that. So feel free to just, it should be question, not the experience, because today's speaker is Dr. Bhavani. We just want that to ask the question so Dr. Bhavani can answer, not your own experience, and because we can understand the time is very limited. So Nirmalji, I am unmuting you. Yes, you can go ahead, Nirmalji.
What should be the criteria? Should it be in the form of questionnaire? Should it be in the form of questions that should be asked to the patient, or some guidelines should be given? How, person can feel that I am at the moment mindful and not forgetfulness has occurring with me. So what should be the criteria?
So if I'm getting the question right, is it like, how can we assess if the person is mindful or not? Is that so? Yeah. Okay.
Yes.
So, yeah. So there are mindfulness-based questionnaires that are available, which has been developed by Ruth Bayer, and which evaluates on 4 phases to see whether the person is actually mindful, or how much they are mindful about what is happening when they say they are mindful. But actually, in clinical practice, I'm not sure if these are developed more for a scientific research and so. But actually, in clinical practice, I think it is more of a subjective experience of the patient also. And I have not evaluated my patients or the cohort that I am teaching mindfulness to, because with mindfulness practice, they become themselves more aware of what is happening and what is not happening, and they would come back and talk about, this happened to me when I was practicing, when I was trying, and I didn't know how to deal with it. So let us talk about this. Let us discuss about that. So is it okay, Dr. Sandeep, if we talk briefly about how to cultivate mindfulness, maybe?
Yes.
So give a brief,
We can take one more question, so we can connect both the questions. So Rajneesh is asking some questions. So
yes, Dr. Bhavani, my question would be, different meditations would have different effects on your brain. So what has been your experience, in exploring different meditations?
Absolutely. Different meditation techniques have different effects of brain. And what I have mentioned here, or with respect only to mindfulness practices. Yeah. For example, I have never mentioned, even though I've said that there is stress management, I've never mentioned relaxation alone as one of the benefits or one of the advantages of mindfulness, because relaxation just comes as a package, as a part of it. Yeah. And there are, although initially all the practices has been clumped together and, just mentioned as meditation in the research. Now, when we look at it, there are divisions. There are clear mention of what practice the particular participant has been taught, or what practice the particular participant has been practicing, and based on that, what is the result that is that they are proposing. So definitely, yes, there are different meditation practices have different effects on the brain. And even within mindfulness practices, we'll be shortly seeing how, when we are cultivating it, that different practices have different benefits even when within the mindfulness practice. Yeah.
I just want to add, Dr. Bhavani, if you allow me.
Yes,
so the good thing about the MBCT is that this is kind of the Vipassana only, to observe your breath, observe your mind, body, and everything, your thoughts also. But great thing about the science is that the things which can be repeated and which can be observed, they comes in the scientific forum and that can be discussed. So MBCT was split into the various parts, and the things can be observed week by week in the patients who was suffering mainly from a depression and the severe anxiety. So with the other meditations also effects comes, but that research has not been done. Recently, last month, I met the HOD of Department of NIMHANS, Dr. Ramachandra. He's a really, really great person. There is a wing in the NIMHANS Bangalore. The name of that is holistic. The psychiatrist is there, a yoga therapist is there, counselor is there, that meditation person is there. They have the team. So they are doing a lot of research on the amygdala, changes in amygdala with different postures of yoga, different meditations. So as those researches will come in the community and the public forum, at that time, we will have a better understanding. I just want to tell one thing. They have a great research that right now we don't have any treatment for the schizophrenia, but they have seen with the meditation, different type of meditation they have created, and with the Shishasana and yoga, they had great impact on the hippocampus and the amygdala. And there is a mood swing is very less, controllability is there, the understanding is very much. So friends, this thing is there, that mindfulness, cognitive therapy or mindfulness, the West has researched it in 1970s and 80s, especially by the Mr. Kabat-Zinn. And right now in India, in AIMS, NIMHANS, lot of researches in Pune also, many researchers, and one of them is Dr. Sanjay Phatke. He's doing lot of research. So right now, as Dr. Bhavani has rightly said, we don't have the study and we can't tell that because the research papers are not there. So yes, India has the John Kabat-Zinn and other persons who was doing a lot of research, and we will have our own therapy, own names, and all the things. So over to Dr. Bhavani. I think this thing was needed because scientifically we have to observe the things.
So it just backs up what is already being known, and it also becomes, with reproducibility, we also have the credibility to say that, hey, this is going to work and you better try and practice this. Yeah, yes.
Exactly.
Keeping time in mind, I'll just briefly say how we can practice or how we can inculcate mindfulness practices for ourselves. That is the reason that this is called as practice, because it's not like I'm going to do mindfulness today and then I'm going to reap the benefits of mindfulness, forever. I have to spend my time, my effort, my dedication, and sit and do it every day. So a research by Dr. Holly Roger points that even as small as 12 to 13 minutes of meditation per day, for every day, is enough for us to start reaping the benefits of meditation. So that is it. So if you can afford 10 to 12 minutes of your time every day, that is enough for you to start reaping the benefits. But then again, there is a dose-response relationship, which is that if you want more, you have to spend more. So the more amount of time you spend on practicing mindfulness, the more the benefits are going to be. So how it can be practiced? There are two primary ways that you can practice mindfulness, which is one, formal practices, which are meditation. And that is mainly is like focused attention, where we choose any one of the sensation. It could be a breath, it could be bodily sensation, it could be sound as an anchor, and then bringing our attention, our focus on that particular object. Your mind will wander. It's not, and that is how it is. The minds are designed to wander. And what John Kabat-Zinn says is that even if your mind wanders 1,000 times in that 10 minutes time period, it doesn't matter. Bring that mind back to the object, the focus that you have in. If it is breath, bring your mind back to the breath and just focus on the breath. Or focus on any object that you're choosing to have your attention on. And slowly this muscle of attention gets strengthened. And without much ado, without much effort, you will be able to focus on whatever object that you're choosing to. And along with this is open awareness meditation, wherein you're noticing being aware, being open to whatever experience that is arising within you. It could be an emotion, it could be a thought, it could be anything that your mind is throwing at you, or it could be even something which is happening out. Just noticing without getting caught in the turmoil of what is happening. And moving on, the other practice could be a mindful movement, which is mindful walking meditation or mindful yoga. And the fourth would be quality-based meditation, which is like inculcating certain qualities, certain like loving kindness, compassion, equanimity into your meditation practice. So when I was talking about how even different practices could change the way that it could, present in your wellness, when we talk about loving kindness and compassion meditation, it is found that they increase the overall sense of positive emotion, overall sense of being, connected and grounded. So with this, even 8 hours of loving kindness meditation is found to be beneficial in improving interpersonal relationships and also in developing that sense of well-being. Whereas when we look at focused attention and open awareness, these are going to help us in increasing our attention, focus, and also memory, added to the other benefits of it. With regard to informal practices, this is like bringing mindfulness into your life, everyday activities. As in, choose one activity you do every day. It could be brushing your teeth, it could be taking a shower, it could be even eating, or just taking a small stroll around, and try to bring all your 5 senses into it. Yeah. When you're choosing to be mindfully present when you're doing that activity, sensing what is happening right now. I'm brushing, so how is the brush even touching my hand? How is it on my how is it in my mouth? What is happening when I'm gurgling? What is happening when I'm swishing? When you start focusing your attention and being open to all these experiences, that itself acts as a mindfulness practice. And with regard to interpersonal mindfulness, relational mindfulness, mindful communication is a very important practice. It involves both mindful listening and mindful speaking. And this is something that we could practice even in our day-to-day lives and our day-to-day activities. And added to that, this is the structured 8-week programs, starting with mindfulness-based stress reduction, mindfulness-based cognitive therapy, and with branching out from these two, there are mindfulness-based childbirth programming, mindfulness-based eating, mindfulness-based relapse prevention. And in Western countries, these has been even started to they've started giving these to schools and in schools as .B PASS program. So that is how mindfulness has expanded, and it has been integrated in every part of the society. So with that, I think I'm completing my presentation, and these would be my references. This is something I wanted to discuss, but I couldn't because of shortage of time. I'm just choosing to skip this slide. And these would be my references. There are 2 books that I have mentioned in my reference. I've always gone back to it. One is Full Catastrophic Living by John Kabat-Zinn, and another is Altered Traits by Daniel Goleman and Richard Davidson. These are excellent resources. And once you start reading, probably you'll also, expand and go beyond that. Thank you so much. Thanks for listening.
Thank you, Dr. Bhavani, for beautiful, short and compact presentation.
Thank you.
There is one question, Dr. Bhavani. I have the vestibular migraine and PPD. Please suggest me the therapy.
I'm sorry?
Can you suggest some? Migraine, vestibular migraine.
Okay. So as such, I cannot suggest a therapy because each and every person, the experience of a disease in each and every person is very different. So what I would suggest is that explore all the options that is available for you. And mindfulness practices as such any meditation practice also could be of great help. So I would suggest that you try these along with lifestyle modifications, lifestyle changes. With regard to migraine, prevention of triggers is the key. And along with that, to know what triggers you and how you can prevent that, and management of an acute attack. These three plays a major role with regard to migraine treatment. Yeah. So try it out, maybe see how mindfulness could help you.
Super. Thank you, Dr. Bhavani. That was an amazing answer, that one have to be aware about the triggers and mindful about the triggers. So he or she can work on those triggers mindfully, and things can be healed also in the due process. So friends, if you have any question, we can take 1-2 more questions. We have near about 2-3 minutes. Can you tell some books, Nirmal Mehta ji asking, which can be read for the personal well-being and development?
Yes. So books with regard to mindfulness. So I assume that's what the question is. One, as I suggested, by John Kabat-Zinn, which is Full Catastrophe Living, that gives you a brief introduction to stress physiology, and also to mindfulness practice. There are also other 2 books by John Kabat-Zinn, which is Coming to Senses, and Wherever You Are, There you are. I think I'm not sure about that title. I'm sorry. So those 2 books are also amazing reads. And as Dr. Sandeep has put, yes, all Thich Nhat Hanh books are wonderful to to get introduced to mindfulness. And there is also a book which deals with which gives you an introduction about mindfulness, which is Finding Peace in Frantic World by Mark Williams. So he's the founder of MBCT. So these are all how mindfulness can be incorporated in our day-to-day lives, and also how we can start practicing mindfulness. So they give a hands-on tips on how we can do that. If you have to look at the contemplative tradition of mindfulness, then Thich Nhat Hanh books are great to start with. There's also a book called Mindfulness in Plain English. And I'm sorry, I can't recollect the author, but the title is Mindfulness in Plain English. Yeah.
Please. Hello, ma'am. Very nice session.
Hi, thank you, Dipti.
Very nice session and very informative. Please share the books in the group, the names of the books. And if PDFs are available, it will be better.
I would definitely share a list of resources either with Dr. Ranjan or with Dr. Sandeep. And the list will be definitely shared with the group. Yes, I think that would be possible, right, Dr. Ranjan? He has already given you the, so yes, we could do that, definitely.
Yes. Thank you.
And there are also a lot of apps that you can get to start your practice. And then from there, once you start developing the practice, if you need any help, you could find a mindfulness teacher nearby you, and then you can connect with them and then start the practice. And even your own group to sit and practice every day.